I'm going to introduce Dawn Wood from Hospice of Southwest Ohio, who will introduce our speaker here in just a moment. And we want to thank them. As I explained earlier to Dawn and to Kelley, that the Parkinson Support and Wellness mission is typically, we typically view it in three pillars. Those are moving and sharing. And in our moving and sharing, the primary role that our organization plays is to support and help grow the available therapies for folks that have Parkinson's. And with support groups, kind of the same thing. We try and provide information about where they are and when they meet, and we try to provide support to the facilitators for their support groups. But we don't really own the exercise and the support groups. We try to be part of them, but we don't own it. The education piece is the part that we do own. And so we have these, as many of you know, because you're returning, we have these educational events on Saturdays throughout the year, usually one Saturday per month. Our next program in March is one that's usually targeted at folks that are newly diagnosed within the last year or two. We call it the basics of Parkinson's. We have, it's an extra long session. We go 2 hours instead of one. First hour involves a presentation from a neuro doctor. And then we take a short break, and then we come back with a panel of folks who are living with Parkinson's to talk about their experience. So we hope you'll join us for that one as well. So we will record this session just so that everyone is aware. And then we put an edited version up on our website later in this coming week, so everyone will have access to see it again. Or if you know someone who missed and would like to see it, they'll be able to find it on our website. With that, I'm going to turn it over to Dawn. And Dawn, if you'd like to get us started.
Yep, sounds great. Thank you, Chris and Carol. Carol was my first contact with your group, so thank you so much for having us on this. It's actually a beautiful Saturday afternoon. Just wanted to talk a little bit before bringing Kelley on about Hospice of Southwest Ohio, as well as CareBridge Palliative Care and Primary Care Services. We are located in the beautiful community of Deer, Indian Hill, and we were established back in 2006. Our CEO is David Walsh. We have two medical directors, one being Dr. Sternberg, Richard Sternberg, and Dr. Arvind Madal. Our mission is to provide quality comfort care and support in meeting the medical, emotional, spiritual, and psychological needs of our patients, families, caregivers, staff, and community at large. Our goal is to provide an environment of dignity and respect, enhancing the quality of life for our patients and their families. It's something to be mindful of is hospice is not a place.
Darlene, I need you to sit down while I'm doing this.
Can you hear me okay? Hospice is a philosophy. So we have an interdisciplinary team that would consist of medical directors, social workers, chaplains, nurse case managers that work with patients and family members. This is typically comfort care. Palliative care is comfort care, which can be delivered high quality, compassionate care at any point when someone has a serious illness of it at any point. Hospice comes into play when there's a 6 months prognosis in terms of the typical development of the disease, meaning that it would be considered terminal within 6 months. That does not mean that folks can stay on hospice much longer than that. There are recertification periods, and folks can come off hospice as well. So it's important to be aware that it's a discipline, it's a philosophy, and not a specific place. And it's not. It's about enhancing the quality of life for the time remaining. In addition, we do have, though, an inpatient unit as well. We have 9 beds available, and that would be residential, respite, and then inpatient as well. So just for you to be aware of that. With that said, we have Kelley Irby, who's one of our lead nurse practitioners. You're in for a treat. Is a palliative care practitioner for a number of years, highly skilled, lots of information to share. So I'm sure you'll be very pleased with what she has to say. If you have any questions about anything, regarding hospice or CareBridge Palliative Care, I did provide some handouts for you as well. So feel free to give me a call directly, and I would be glad to help you further. Kelley.
All right. Thanks, Dawn.
You're welcome.
But today I was going to talk to you just briefly about what exactly CareBridge and palliative care are, and why the services are extremely beneficial for you and your families. CareBridge currently is made up of 6 nurse practitioners. We have added assistance from, like Dawn said, physicians, social workers, chaplains, dietitians, and even more. The number one goal that CareBridge has as palliative care is improving quality of life. So just like Dawn had mentioned, palliative care is basically a type of specialty, just like your neurologist or a heart doctor or lung doctor, except the specialty of palliative care focuses on not just one part of the body like the other specialties, but we focus on you as a whole, and any symptoms that you may have related to your Parkinson's or any other chronic illness that you may have. Some of the symptoms that we typically see a lot of are pain, shortness of breath, constipation, depression, anxiety, and not eating or not sleeping well. But whatever symptom you find distressing is what we focus on managing. So that may even include treating frequent urinary tract infections or respiratory infections like pneumonia. We take the time, each nurse practitioner that is assigned to you takes the time to sit down with you and your family to come up with a personalized treatment plan that fits you. And we do that in the comfort of your home or care facility if you're at, assisted living, independent living, skilled nursing facilities. We go to all those places. But dealing with a chronic illness is very stressful and draining, both physically and emotionally for both you and your family, which is why we take that approach of treating. CareBridge Palliative Care helps manage symptoms, which will then hopefully keep you out of the hospital. That's one of our main focuses too, is hopefully then to prevent that. We're basically another contact point for you and your family. We're really an additional support system because we're here to provide guidance and help clarify your goals of care and wishes in advance, which is something we discuss pretty frequently with everybody. I typically tell people we discuss it every 3 months at least. But sometimes we even discuss it every visit. It really depends on everybody's needs. Because again, it's very individualized. But we also help bring other services into your home if needed, like from home healthcare companies. Nursing, physical therapy, occupational therapy, speech therapy, social workers, home health aides, things like that. We can order those services and get those in your home as well. You don't have to give up your current providers or other services either, because palliative care services are in addition to what you already have in place. And it's billed through your insurance, just like any other doctor's visit. So however it works when you go to the doctor, it actually works the same exact way. It's not an additional set of fees or anything like that for us coming to your home. So whether there's a copay or what have you with your current insurance, it works the same way. But for people specifically with Parkinson's disease, falls and pneumonia are actually two of the top complications that can lead to death. So palliative care, how we can help in these specific situations is not necessarily prescribing a medication, but it's more of prevention and early detection of an issue. So for example, in the case of falls, it's important for people with Parkinson's to stay as active as possible for as long as possible. So palliative care focuses on helping preventing the fall. So that can be done by getting therapy set up, those services in the home, like I had just talked about. And then that can actually be outpatient or in your own home. And then in the case of pneumonia, for example, palliative care is there for the early detection and treatment, which is really important. So we're able to order x-rays or blood work to actually be done in the home as well. And then prescribe the medication or an antibiotic in the case of pneumonia. But having the advantages of that extra contact and support from CareBridge just means for quicker treatment. And then that means it's quicker for you to get back to be living your best quality of life. If you're interested in CareBridge, for yourself or a loved one, it's actually really easy to get enrolled. And there are multiple ways of going about getting a referral. You can talk with your primary care provider or any other specialty doctor, like your neurologist, for example. And we even get many referrals from home healthcare companies. So if you already have one in place, they can get one sent to us. Or if you're in the hospital, you can speak with someone in the hospital about that, and we can get referrals that way as well. Once you go home. And then, but it's really easy to get started with the services, even if you're just interested and think, it would be beneficial for yourself or someone in your family. That's basically kind of the overview of what CareBridge and palliative care services are. Then now is the time to ask the questions. If you have any, I can definitely answer anything if I'm able.
Kelley, this is Carol.
Yes. Yes.
When you're talking about this goes through insurance, now,
Yes.
and which almost always involves copays. I'm just trying to get an idea of what kind of costs, are out there for these things, just a general idea so people know a little bit about what to expect, because insurance is notorious for not really covering
Right.
things very well.
Right. Yeah. Dawn, do you have more specifics on that? I know I can tell you that I have heard a lot of my patients say, honestly, they don't wind up having to pay anything. A lot of my patients tell me that. I don't know the specifics though to tell you as far as, which insurances they have and things like that. But I do know that it is covered by most private insurances.
That's right.
80%, I think that Medicare,
Medicare is
correct
80%.
on.
Right.
So, but other than that, I don't know any more specifics to tell you.
So Medicare does cover it?
Yes.
Okay.
Mhm.
Yeah, because I think the majority of people involved in this would be on Medicare.
Right. I have a lot of patients who are on Medicare, Medicaid, Humana, Aetna.
Mhm. Yeah, that helps to know, because I think I've always thought that people just had to pay for it.
Right.
On their own.
Which is why I always I tell everybody that, it's actually billed the same exact way if you went to the doctor. It's not an extra out-of-pocket expense or hidden fees, anything like that for us coming to your home.
No, that's good. That helps a lot. Thanks.
Yeah, you're welcome.
If you have a question, unmute your unmute, go to that little microphone down at the bottom and unmute yourself. So
Are you the only company that does this work?
pardon?
I believe, Dawn, is there one other, two maybe?
Right. There are. Yeah. What I would focus on kind of what makes us different and great at what we do. It really is the quality of compassionate care that we deliver. And then as Kelley was saying, the interconnectivity to Hospice of Southwest Ohio, access to all of the additional resources, social workers, all of that. Excellent. I wanted Kelley to speak more to how palliative care helps prevent hospitalization and all of that. That's really key. So
Yeah.
Yeah.
Do you want me to talk more about that?
Yeah, that would be great.
Yeah. So it's just the fact that we're that extra set of eyes, we're that extra contact. So you can call us, we have an on-call. So we actually have a nurse practitioner on call 24/7. Not that can come out, but at least you can speak with a live person. If there's any questions, concerns, if anything's going on, we can call in prescriptions, things like that. So, those types of services are available so that hopefully, if you contact us and we're able to help you right then it would prevent hospitalization. It would prevent you from having to, oh no, it's a Saturday night. What am I going to do? I have to go to the hospital. Because again, you have that extra contact point of CareBridge, and you would speak with a nurse practitioner that would be able to, we're able to diagnose, treat, prescribe, everything like that.
I have another question. How do you know when you're ready to call CareBridge?
Yeah, so there is actually that screening tool, Dawn, Dawn had attached that can also help, kind of that question. If, you're not sure if you would qualify or anything like that. But basically, a simple way is if you have a chronic condition, a chronic illness, with chronic conditions comes symptoms. So again, pain, shortness of breath, swelling, like with heart failure, COPD and shortness of breath, nausea, not eating or not sleeping well. Any of those types of things are things that we try to manage. So, you know, like the screening tool, you know, going through there, the heart failure, Parkinson's, dementia, COPD, all of those things have symptoms attached with it. And so I would say if you had those, then you would definitely be eligible.
Thank you.
You're
Just
welcome.
just a reminder that this tool, along with a couple of other items, were attached to your invitation. So you can download these items from the invitation that you had. We have a question from Rebecca Irwin. Rebecca, you want to, there you go.
Sure, yeah. So how long do people usually use your service? Is it something that can just continue?
Yes, yes. It actually can continue. So as long as they have the chronic condition, which will be a lifetime, unfortunately, they can have it for as long as they are able.
And can you talk a little bit about what counties and states you cover?
Dawn, what are the four? We do it by territory, so I know my territory.
Sure. Thanks, Rebecca, for that. Yeah, I meant to do that. We actually are in Butler, Hamilton, Warren, Claremont, and Montgomery County also. So we extend north as well.
So one of the symptoms that's not on this indicator is frequent falls, unless I missed it. But that's such an important part of.
Right, which is why I had mentioned that, because, you know, especially with Parkinson's or other movement disorders, you know, that's a huge one.
Mm-hmm.
But that's another thing that, you know, CareBridge really focuses on too, is just the prevention of that.
Mm-hmm.
So what things can we do? You know, I talked about the services we can get in the home for people, but we can also get, you know, get people in contact with Council on Aging, get their services in the home. They're a great resource, who can, you know, put different equipment in the home, you know, grab bars, things like that. So just being able to pool all these resources for people that they can have in the home that a lot of people don't realize they can get in the home. But those types of things help prevent the fall, which is really, really important.
Yeah, it is. Do you work with occupational therapists in this regard?
Yes. So I have done that in the past too, if they do not have home health care in place already, I will send an order to a home health care agency and ask for nursing, and then also occupational physical therapy. A lot of times I've had to do speech therapy for people, you know, with swallowing issues and things like that too. But yes, all of those things are available to people. So it's a great, you know, service to have in the home.
Yeah.
We have a question from Janet. Janet, you want to unmute your mic and.
So is there a comparable service in Northern Kentucky, or do you have CareBridge in Northern Kentucky?
Unfortunately, we do not have CareBridge in Northern Kentucky, but Dawn, did you want to say any?
St. Elizabeth's is a good resource. And I also wanted to mention, I put up a hyperlink to a quiz that we have on our website. So I would recommend that you take a look at that as well. And it gets a little bit deeper into some specific symptoms. So that might be helpful too.
Is that the one you sent?
Yeah, I just put it in the chat. Yeah,
Okay, thank you.
you're welcome.
I just wanted to say too, for Kentucky, I believe St. Elizabeth doesn't come to your home. So a lot of times I've heard of people using bluegrass care navigators.
We've just put up that quiz.
Thank you, Becca.
What support is available for the caregivers?
So a lot of times, that's when we'll try to get social work involved. So there's a couple options for that. We can either, again, for home health care companies, we can utilize their social worker, or Hospice of Southwest Ohio, our sister company, like Dawn was saying, we can utilize their social workers if they don't have home health care in place. We can, there is a company service called Array of Hope, which is another place that we usually bring into the home. You know, we can send them a referral. So it's that extra support that we try to pull in for the family members.
Okay, any other questions?
Well, if no one else has a question, I have another question.
Go, Carol. What do you think we're paying you for?
That's how I make the big bucks. How do you work with the patient's own care, doctors and people like that, coordinate things?
Yeah, so we stay in contact with them. We collaborate with other providers, you know, or other services they have. And, you know, we let them know if there's a medication that we've prescribed, or even medications that we may think should probably be changed. We would contact them. We would not just change their medications or anything like that without their current provider know that.
Yeah. Yeah, it gets kind of complicated because there are so many providers involved in, especially in Parkinson's.
Right. All the different specialties and things like that. Yeah.
Yeah. So in some ways, it sounds like your case managers.
Right. I get that a lot. Yes. But yes, no, we definitely, we just, you know, we're able to pull a bunch of different services for people, and again, have that extra support, that extra contact. You know, we have a bunch of, you know, kind of hard discussions and things like that with patients and their families and everything.
Yeah, that's good. It's like a point of contact for a lot of
Yes, exactly. Yeah.
That's really, really a big deal.
Yeah.
It helps a lot.
I have a question. If you are still able to get out for appointments and that, do you still provide in-home visits?
We do. So typically there's a certain, I'm trying to think of how to, if someone only had pain issues, but they were not homebound, then they would not be eligible. But when someone is able to get out, but it's difficult to get out, you can still have our services. You don't have to be absolutely homebound and never go out or anything like that. Because again, you can keep your, you know, current providers and other specialties and things like that. Does that make sense? Answer your question? Okay.
I have another question. You know, as all of the people that we come in contact with, we live in an independent living facility.
Okay.
And all the people that I know from the past and here and everything like that, when I talk about palliative care, they don't know what I'm talking about. And
Yeah.
it's
Yes,
just,
that is very, very common. A lot of people equate palliative care to hospice.
yes.
Not the same thing.
Mhm.
Basically, I know Dawn talked about it a little bit, but basically the difference between hospice and palliative care. So we have the same goal of comfort and living your best quality of life and everything like that. That is the same. But with palliative care, you can have your provider still. You can still get treatment. You can still, you know, again, you can have all these services.
Mhm.
Hospice, it's more of when down the line, when you don't want any more aggressive treatment and all of your providers, it would be hospice, would be your providers.
Mhm.
But palliative works with the other providers as well. Does that make sense?
Yeah, yeah, I've tried to understand it for years, but it just seems like it's not in your face. It's not advertised. It's not talked about at your, you know, in your physicians, or it's just like it's not there. I mean, it's just not been very satisfied at all with the response.
That's very true,
right.
Unfortunately.
What can you do about that? Can you, I mean,
I guess have these types of
Absolutely.
education.
Yeah.
Okay.
Right.
Yeah,
I
I
agree with
mean,
you, Pat.
doing
Totally. Yeah.
education type things like this, or, you know, I mean, honestly, even there's other providers, you know, primary care providers, or even other specialties that don't, you know, truly know exactly what it's about. So, I mean, honestly, even having like education in services, things like that at, you know, different doctors' offices, just like, you know, drug reps do, you know, for medications.
Right. That's
Yeah.
a lot of our focus, because we work with CareBridge and hospice, is to reach out to the physician groups in particular to help them understand and get the message out. So great point, though, Pat. Spot on.
Yeah.
That's why we're doing this, because there is a lot of confusion about this whole subject.
I know our neighbor, their daughter is a doctor and she specializes in palliative care. She goes a lot on social media also too, and promotes it and promotes the program and does a lot of explanations, which are very helpful. And she gives sources where, you know, again, just like you have done, Kelley and Dawn, where you can reach out to different people in different places. But that's been that's where I originally had come across it. And I wish it would have been available for my mom, but a few years ago, it wasn't so much. It was hospice, and that was what was just presented then. Yes. So thank you.
Yeah, you're welcome. I know Dawn has been doing a lot more with, you know, getting information out there. And I know we just redid, you know, our webpage and updated that and provided more information. So I think, Dawn, there's going to be a lot more probably coming.
Oh, for sure. Social media. And then I was also telling Chris that I'd love to get, you know, a link going so that like a resource page. So not only, you know, people can go to our website and find you guys, and you can find us, and, you know, connected.
Yeah, one thing you said, Kelley, that I'm not sure I heard right, is that you, if you're capable of getting out and going to the doctor yourself, you're not eligible for palliative care?
No, what I was trying to think of how to, there are people who are no longer eligible, but that's in cases of if they only had, for example, pain
Mhm.
And they can get out. So in those situations, you know, they would no longer be eligible for palliative care, just because if their only symptom, absolute only symptom is pain, but they can get out, they can go about, you know, go around, go to the grocery store, that's what I was saying for that. But in the cases of chronic illnesses,
Mhm.
like Parkinson's, heart failure, COPD, things like that, it's not that they only have pain. They have, you know,
Yeah.
what I already talked about, the shortness of breath, the frequent falls, frequent hospitalizations, and things like that.
Yeah, that helps. It's sometimes a difficult subject to wrap your head around. And I think
Right.
the more we can talk about these things. And I don't know if you're familiar with a book called Being Human. It's written by Atal Gawande.
Okay.
And that's
Being mortal. It's being mortal.
Oh, is it Being Mortal?
Yeah.
Sorry.
That's okay.
The brain is the first to go, I think. Yeah, he was one of the early proponents of palliative care. And I think it's really helps to read that book to understand a little better, you know, what it's all about. But I do think, you know, it's really important for more people to understand just how much better things can be if you have these kind of resources.
Right, right. Yeah, and I mean, that's something that I know that we track too is, you know, have we helped prevent hospitalizations? You know, that's something that we look at. Because again, I mean, that's one of our goals is hopefully keep you out of the hospital since you have us as a contact. You have us, you know, you can reach out to us and, you know, if there's anything going on.
Yeah. Well, I think also somebody mentioned caregivers. And I think something like this may be a lot of support for caregivers, like, because it's sometimes really hard to know what's going on. And if they have a ability to call you all and talk about it, that helps make the decision. And that takes a lot of pressure, I think, off of a lot of caregivers.
Right, right. Which, you know, that is another one of our goals is to help kind of prevent that or reduce, you know, the stress that comes along with that.
Yeah.
I know something else that is available with CareBridge is respite stay as well. Now, that, Dawn, that's out of pocket though, correct? Yeah, but I mean, you know, that's another thing that would be available. You know, we could help get that set up for the caregiver. So I apologize. I didn't completely forgot about that when the question was brought up, but that is another thing that we can do and get set up for caregivers.
That's great. Thanks.
Yeah. Mm-hmm.
Okay, I'll ask again. Do we have anyone else who has a question for Kelley or for Dawn? You can go ahead and open up your mic and ask the question. And if not, then I would like to, first of all, on behalf of the organization, thank both Kelley and Dawn. As you can tell from the interaction questions that we got, this is an important subject, and that indicated difficult to find much information unless even to know whether or not you should be seeking information. So we appreciate the tools that you provided as well as all of the information today. This is one of a series of the educational events that we will do throughout the year. We hope to get back to a in-person ability to have these PDEDUs in various libraries around our service area. But I can tell you that this virtual aspect has worked so well that even when we get back to meeting, we'll probably still make it available via this Zoom platform. And I just wanted to take a moment to talk about a couple of programs that will be coming up in the next couple of months. And I won't go into too long of a commercial about them, but perhaps one of our most popular PDEDUs is the one that's coming up in March. So exactly a month from today, Saturday, March 20th, we'll do the basics of Parkinson's. Our doctor will be Dr. Emily Hill from UC Health and the Gardner Neurological Center. And Dr. Hill will provide about 45 minutes of discussion in depth on Parkinson's and if you've been recently diagnosed, what to expect. And then we'll field questions. And Dr. Hill will then be followed by a panel that of persons with Parkinson's as well as their care partners. And that will be a panel presentation talking about their personal experiences upon getting diagnosed, and then what their experience has been in the years since on finding and crafting a way to live well with Parkinson's. So that's Saturday, March 20th. As you can see with what I'm showing here from our website, that is a 2-hour long presentation instead of a 1-hour long presentation. And this year we are going to enhance that experience, and we're going to enhance the experience with a series of meetings. And I'll just share this.
I am listening to this thing on palliative care.
What?
Palliative care.
There we go. So we'll have a new continuing program following the basics of Parkinson's called Beyond the Basics. And that will be a series of 3 meetings that will take place over the course of the next 3 or 4 weeks in March and into April. So we're really excited about this new program, and I want to thank the program committee and in particular Elizabeth Grover for being the impetus behind taking that basics of Parkinson's and expanding it and really filling a need that we've heard from our community. I'm not going to keep flashing commercials at you on the screen here, but the other important event that will be coming up will be our spring forum. The Spring Educational Forum this year is April the 4th?
10th.
No, it's the 10th.
The 10th, that's
April
right.
10th.
We got Easter on the 5th. So April the 10th, that is a 4-hour long virtual presentation, and we'll have a guest speaker from Rutgers University, and then we'll also have guest speakers from UC's Gardner Center, Dr. Espay and Ben Stetcher. So look to our website for information on those educational programs, and with those, you'll also have an opportunity to register for each of the programs, just as you did for this one. Look for that registration for the basics of Parkinson's to show up and be available on our website by Monday. With that, if we have any other questions, I'm happy to answer those.
You got a question?
Yes. Do you have anybody on staff that works with the individual to help them interface with their long care insurance provider to get benefits from them to pay for some of this?
So is that question to me or is it to Dawn and Kelley?
Well, it's to whoever is I'm not
Whoever
sure.
has a good answer?
Yeah, or whoever is part of CareGive. CareBridge team.
I'll go first. We have, when you self-refer, we have an intake nurse, Christy Butler, who is very knowledgeable about the process. So I would recommend, you know, our nurse can help with that. Kelley, do you have?
Hi, this is Maureen, nurse practitioner at UC. I'd also interject that we do have a social worker. If you're a patient at UC, we have a social worker available that can help you navigate that. We also have, as the Parkinson Support and Wellness, a social worker available. So if you're not a patient at the university, we can explore those avenues with you.
Okay, that's what I wondered. Supposedly, I've carried long-term care insurance for decades, and supposedly a couple of the more recent additions to what they cover are things like if you have a partner that's giving you home care in your home, that they would pay for that partner, and also pay for outside help from companies like, I guess, yourselves. Are you incorporated as a company? CareBridge is CareBridge. What kind of an entity is CareBridge?
Okay, well, we're a non-for-profit corporation. And specifically, we would be dealing with folks that are being referred to our program. I think the nurse practitioner from UC was speaking about community resources at large. So I think both of those.
Okay, well, I am a patient at UC, not right now, but when we moved here primarily because UC has their hospital here in Westchester, and we wanted to get all my doctors in one place working together. Mm-hmm. And so we've had good luck working with Maureen Gardner in the past and Dr. Sahai. But I never heard them mention anything like this program. And Maureen, she seems to be pretty well informed. I just wondered what kind of, how you get an interface between those caregivers and yourselves to help the patient work through the program.
Kelley, you want to talk about UC Health, Westchester?
Yes.
Did you want to?
Hi, this is Maureen.
Oh.
Mr. Murray, we can certainly discuss this at the next appointment. I guess I'd never brought it up because I didn't see it as a need, but
I didn't see you either.
So
I agree. He doesn't need it yet.
Okay, so we can certainly talk about it when I see you again.
Thank you.
You're welcome.
Becca, can you tell us a little bit about what your service as the social worker associated to UC Health?
Sure, yeah, I was excited to chime in. So I am the social worker at UC Health. I work with Maureen and Dr. Espay and Dr. Duker and all of our wonderful providers. And that's part of what I can do is to help assist you in navigating some of these resources that Dawn and Kelley have talked about. And, you know, I think we've heard that frequently that a lot of times palliative care it's not brought up. And I think a lot of patients and family members feel like if it's something that is needed, the doctor or the nurse practitioner will bring it up to them. But sometimes it just doesn't happen to come up in the conversation. But I think in the Parkinson's Foundation has really made a push in the last few years to increase services for palliative care and bring that as another tool in supporting caregivers
Oh, mailman.
Definitely something that is, I feel like, becoming more and more a topic of conversation in the last, even since I've been at UC, it's something that we're using more and more. So becoming more known as an option and a resource and support. So we just recently had Dawn and Kelley come in and talk to some of the providers at UC. So we're all kind of on the same page as what they provide and what's available out there. So that's why I was excited that, you know, we're doing these conversations out in the community to get the word out about palliative care. And definitely as the clinic social worker, I can help connect your family with the resources and also, you know, help with the referrals and the insurance and all of those things.
Right.
Yeah, Dawn, speaking from
I'm sorry, go
experience, you know, Rebecca is a great resource. You know, she's like a go-to person for help outside of the other providers, but she does a really great job. So I wouldn't hesitate to get in touch with her if you've got a question. I think that's half the battle sometimes is we've got a lot of great resources like Dawn and Kelley and then Becca and so many good people, and most people don't know they're even there and you know what they do. So, you know, advertising is everything, I guess. And thank you all for doing what you do.
Yeah, before we go, I just have to put in my thank you plug. I am just so appreciative of Parkinson's Support and Wellness, #1. And then for CareBridge coming, for Rebecca coming with the UC, with the social worker aspect at UC, the amount of support that we have in this area is phenomenal. And I just have to say thank you again to everybody who is helping all of us who are living with Parkinson's and being the caregiver of the person living with Parkinson's. Like, it's wonderful. So I just had to say thank you, and I really appreciate everything.
Thanks, Jan.
And
Thank you.
yes.
Well, I think we are at the top of the hour. So again, I want to thank Kelley and Dawn for providing so much information. And you can always tell that while questions may be slow to start, it's always interesting how we fill up right to the end with some great questions. So I also want to thank everybody who participated. I sometimes am remiss in also thanking those volunteers who work with Parkinson Support and Wellness, and in particular, the folks on our program committee. They spend a lot of time coming up with ideas and then seeking out subject matter experts, getting them to commit to participating in these. So to those of you who are on the program today, I thank you very much on behalf of the organization as well. I had flashed there for a moment. Our website is parkinsoncincinnati.org. And there's contact information there. So you can email us, you can call us at the office. We are a small non-affiliated organization. We're not affiliated with any of the national organizations. Our focus is for persons with Parkinson's and those who love and care for them here in about a 32 county area in Southwest Ohio, Southeast Indiana, Northern Kentucky. We thank you for joining us today. Hope some of you will join us in March for the Basics of Parkinson's and Beyond the Basics, and then in April for our Spring Forum. With that, I'll give you back your Saturday. And again, thanks for participating.